Dr. Amit Thakker joins us from Nairobi. He's the chair of the Africa Healthcare Federation. Thanks so much for joining us on the News Hour. First of all, what strikes me is that as we've been covering this coronavirus, there had been all these warnings that Africa would be the next epicenter of the coronavirus, that it would be extremely bad there. But it seems that hasn't happened. Why is that? Is it a different immune system, the climate, or not enough testing, or has it just not reached that level yet?
Yeah, yeah. Thank you for the question, and thank you for having me in the show. I think we've heard about issues like climate. We've heard about BCG vaccinations being a protector. We've also talked about the youth, but we don't have any scientific evidence of that. You must actually remember that we are in the early days compared to many other countries around the world in Africa. We, on average, are around 45, 50 days per countries. Other countries have surpassed 100 days into this virus transmission. And if you look at the cases, like you mentioned, 20,000, to actually give you the correct figure, yesterday we had a total of 42,000 cases by 3rd May. And 53 countries have got positive cases recorded with about 1,700 deaths. So we are mirroring Europe very quickly. We are very concerned. And to actually say maybe there's a protection in Africa, it's not moved at as fast as we would expect it, may be actually a wrong assumption. In fact, we are very concerned in Africa for the next 50 to 80 days and what we'll see here in Africa.
And given those concerns that you have regarding Africa, how well equipped are healthcare systems to cope? Just to quote, for example, Cameroon has only 30 ventilators, roughly, for a country with 25 million people.
You're absolutely right. Our health systems are weak, our hospital capacity is low, and our human resources for health are also very scattered. And this is the reason why there's a big public health debate and an economic dilemma. We cannot let the public health issue be made privately. So in Africa, there's a very delicate balance between the public health restrictions and issues around social distancing, closing businesses, and when do we actually open. So many countries have tried to lock down, and other countries are experimenting more like a cessation of movement, and other countries are planning to open up some businesses. So I think in the next 2 months, we will see variations depending on ability of each country. We need to be very careful. I think we need to allocate more budgets to livelihoods and providing food parcels to all the vulnerable population in Africa as we practice a lockdown in many cities across this continent.
And what do you think could be the economic consequences for Africa? We've heard of debt cancelling for many countries.
Yeah, I think the economic consequences are grave, but there is an opportunity that's brewing with the issues to do with China and probably relocating our trading partners. We'll see more trading between Africa. We have repurposed our manufacturing companies. We have looked at technology. We got innovation hubs. So I think there's a glimmer of hope that when we surpass and come out of this COVID, Africa could become a stronger and a well more positioned continent to be counted as a global trading partner. We just need to tread carefully and manage this course well.
Dr. Amit Thakker, it's been a pleasure to speak to you here on the News Hour. Hope to speak to you again.